UK, and I'll be looking at it. There you are. Recording is now in progress. So we'll be keeping an eye on that as we go along. So do put questions in the comments in the chat as we go along. There'll also, then at the Q&A spot at the end, the raise hand function is available. So if you want to say your question, cameras won't work, but you can say your question. It's easier to say it rather than try and type it. Right. Over to our speakers. So at the top of my screen, probably only, it may not be for you as well, but you can see here on the screen. Okay, on the left of the screen, we've got Molly. And Molly Russell is a research coordinator at SOS UK. She was really instrumental to the success of this survey. So she's going to be the one that's presenting the findings from this current survey, the Student Alcohol and Drugs Survey 2024-25. The other person that you'll be hearing from today is another Fiona Murray. Fiona is project manager at in the wellbeing team at SOS UK. So this is very much her work as well. Most recently, Fiona's been working on a national project aiming to reduce alcohol-related harms in the student population, which you'll see from the survey is a really, really important and priority piece of work. So Fiona's going to be picking up some of the main actions following the survey and thinking about how you as practitioners can embed these findings into your practice as well. So I think they're both going to disappear, and I'm going to do a little bit of an introduction. So setting the scene. I just want to say a little bit before I do hand over to the two people that are going to say the really useful stuff here today, about the context of the survey and why it's so valuable. So as well as my role as chair of the Drug Education Forum, I am also director and founder of a drug education charity, the Daniel Spargo Mavs Foundation. We work primarily with schools, also with colleges and community organisations, well over 800 across the country, but mostly under 18s or up to 18s. We'd love to do more with universities, but we are very much in the business of preparing young people to manage decisions about alcohol and drugs and other drugs safely in their life beyond school, which for many will mean university. Young people's use of alcohol, tobacco and other drugs has been on an overall downward trend since the 1990s. So after over the last few decades, it reached a bit of a peak then. Levels of individual substances can fluctuate, but the overall rate of decline the overall rate of decline seems to have slowed down. But the data tells us that fewer 16 to 24-year-olds are doing these things than 30 years ago, which is a good thing. But alongside that general decline, drug-related harms more recently have increased. And that raises a number of questions and a number of concerns for those of us working in this sector. Above all, it makes it ever more imperative that we have a really good understanding of what that complex picture looks like, and what we need to be doing as professionals to reduce the risks of drug-related harm for the young people in our care. And it really is a complex picture. The use of alcohol and other drugs by young people is a constantly, often rapidly changing landscape, much more so than it is with adults. It's not just the what and how much. Alcohol use seems to be down, ketamine use has been increasing, but also the how. So smoking herbal cannabis now alongside that, vaping THC, but is it really THC or is it spice, synthetic cannabinoids? And also the why, how motivation shifts, perceived physical or mental health benefits, spiritual benefits. Also the where, the social context of the use of different substances can change. Perceptions of risk and benefit can change. Changing influences and sources of influence on behaviour and decision making. All of us doing what we do, working in this sector, trying to support young people to manage decisions around alcohol and other drugs safely. We can do what we do so much better if we've got a current, accurate picture of what's going on for the young people we're working with. And hearing directly from young people themselves, of course, is by far the best source of data. But reliable, regular national data is a bit thin on the ground. For 11 to 15-year-olds, we've got the Smoking, Drinking, Drug Use Survey, which is commissioned by the government every couple of years, and that's really, really rich data. But it is just 11 to 15-year-olds, and it is just England. For 16 plus, there's a small number of sources. For example, we've got the annual crime survey data, which picks out 16 to 24-year-olds, but there's nothing like the granular detail that the SOS UK survey has, which is one of the many reasons why it's so incredibly valuable. And there's also nothing that's looking specifically at this particular cohort of young people and what their particular needs and priorities and vulnerabilities and so on might be. The SOS UK survey has been so incredibly valuable to us as practitioners, running a drug education charity, working with young people day in, day out, because of its insights, not into just what's being used and how much. There's also so much rich content relating to the social context of use, attitude, motivations, experiences, impact, also access to support, access to information, access to advice. The fact it's refreshed every year means that it really is our best shot at capturing students' voices in the here and now, which is absolutely what we need. Also, because it's an annual survey and it's been running for 5 years now, we can be looking at trends and we can be looking at shifts and how that's changing over time and what that tells us about what we're doing, what we need to be doing and what we need to be alert to. So I am going to stop there. I'm not going to say anything about the survey in particular because Molly and Fiona are going to do that and they're going to do it much better than I could. But I really would urge anyone working with young people in any way, obviously you're here because you want to find out more, but please do spread the word. Do share the survey around. There will be a link to it that you can access. It is now live, which is really exciting. But think about this, part of what today is about is thinking about how it speaks to your own practice. What's particularly relevant to you? What do you need to be thinking about in terms of informing your lives with your peers if you're a student yourself or if you're working with young people? So I will disappear there and I'm going to hand over to Molly, who is then going to hand over to, are you going to hand over to Fiona? Fantastic, lovely.
Thank you so much for that fantastic introduction, Fiona. That's a hard thing to follow up now. Um, I'm so delighted to be presenting the findings of our 2024-2025 survey. We do have a lot to get through, so I'm just going to jump right in. So in 2024-2025, the data represents 11,894 students in higher education, which is our highest number of responses for this survey ever, which is amazing. Of these nearly 11,900 responses, 77% are undergraduates and 52% are undergraduates in their first or their second year of study. I'm going to discuss changes in our findings from 2021, but primarily between 2023 and the latest wave of research we conducted in 2024. Firstly, however, I would like to point out the label that should be in the top right of your screen. This indicates whether the data on the slide refers to alcohol or refers to drugs, as we asked respondents about both in the survey. These labels are on all slides to make it really clear which I'm referring to. So the chart on this slide shows alcohol-related behaviours and perceptions across the 4 waves of survey research. I think it's worth noting that the number of respondents has changed year on year. And also then asterisk next to a percentage indicates statistically significant difference from the previous year of research. So if we begin with the dark blue line, which is at the top of the chart, this shows how the perception of alcohol in university culture has fluctuated over the past 4 years. So specifically, the percentage of respondents who say that drinking and getting drunk is part of university culture. In 2023, 3/4 of our respondents, 76%, agreed that drinking and getting drunk is part of university culture. In our latest wave of research in 2024, this significantly increased to 81%. If we then move down to the light blue line, this shows changes in respondents' behaviours of drinking at home before a night out. So the percentage of respondents who say they regularly start drinking in a house before they go out for the night. In 2021, 61% of our respondents reported this. In 2022, this significantly decreases to 38%. I think it's probably worth noting that this is likely due to the influence of the pandemic. In 2023, this significantly increases to 54%. And then our latest wave of research in 2024 decreases again to 42%. The pink line that is at the bottom of the chart demonstrates fluctuations in the impacts of drinking on academic life. So specifically, the percentage of respondents who say they've missed a university seminar, lecture, or class during or following drinking alcohol. In 2023, 38% of respondents reported missing a seminar as a result of alcohol. This rises significantly in 2024 to 44%. Similarly, the chart on this slide shows changes in perceptions of drugs in university culture, of our respondents' frequency of drug use, and their awareness of institutional drug policy. I think, again, worth noting that respondent numbers do change year on year. The dark blue line, starting at the top again, so that line demonstrates respondents' awareness of university drugs policy. So specifically, how many respondents report that they don't know if their university has a drugs policy. In 2021, 35% of respondents reported this. This then significantly increased to 44% in 2022. In 2023, it significantly decreased to 33%, reporting that they don't know if their university has a drugs policy. And in our latest wave of research, this remained relatively stable at 33%. Moving down then, the light blue line shows changes in perceptions of drugs in university culture. So in 2023, a quarter of our respondents, 26%, reported that they agree that taking drugs is part of university culture. In 2024, this significantly decreased by 2% to 24% of respondents. Lastly, the frequency of reported drug use by respondents also varies, as we can see with the pink line at the bottom. So in 2021, 13% of respondents reported that they use drugs at any frequency. This significantly decreased in 2022 to 10%, and then significantly increased by 11% in 2023. In our latest wave of research in 2024, 20% of our respondents reported that they use drugs at any frequency. I'm now going to discuss our respondents' alcohol consumption habits, their reasons for drinking, and their attitudes towards alcohol. So a quarter, 26% of our respondents currently do not drink alcohol. This is compared to nearly three quarters, 74%, who say that they do. We asked respondents who currently drink alcohol what reasons best describe why they do so. 57% said for recreation, 55% to enhance my social interactions, and 30% to improve my confidence. We also asked respondents who currently drink alcohol about their drinking practices. 4 in 5, 83%, agree that drinking too much too quickly can cut short a great night with their friends. Over three quarters, or just over three quarters, 76%, start drinking in their house or their friend's house before they go out for the night. And 2 in 5, 37%, said that it can be difficult not to drink too much on a night out. Similarly to the previous slide, I'm now going to discuss our findings on respondents' behavioural patterns and practices in relation to drug use. So 1 in 5, 20% of our respondents currently do use drugs. It's worth noting that the following data on the slide refers only to the sample who currently use drugs or have used drugs in the past whilst as a student. We asked this sample what reasons best describe why they use or they have used drugs. 64% said for recreation, and 24% to enhance their social interactions, which align with our findings of why students drink alcohol. Additionally, 21% of respondents who currently or have used drugs say that they do for something to do or because of boredom. The most frequently reported drug used is cannabis. 7 in 10, 69% of respondents who currently or previously use drugs report using cannabis. The most prevalent response when we asked respondents where they take drugs was at home or in their accommodation, with 56% reporting that they do so. The most common way of procuring drugs was from friends and or from family without payment, with 44% of respondents saying they do so. And then lastly, 2 in 5, 41% of our respondents report that they have never used 2 or more drugs at one time. I'm now going to discuss students' perceptions of alcohol on campus and university culture. So the chart on the left shows respondents' perceptions of how much students drink, both their perceptions prior to starting university, which is represented by the pink bar, and their perceptions since being at university, which is the blue bar. 14% of respondents reported that they believe that students got drunk all of the time prior to starting university. Since being at university, this more than halves, with only 6% believing this. In terms of perceptions of university culture and of alcohol, 4 in 5, 81% of respondents agree that drinking and getting drunk is part of university culture. A similar number, 79%, agree that it's almost expected that students will drink to get drunk. Similarly, this slide shows our findings of respondents' perceptions of student drug use and of campus drug culture. We asked respondents what percentage of university students they think use drugs, which is represented by the chart on the left, both before they started university, which is the pink bar, and now they are a student at university, which is the blue bar. Before starting university, 91% of respondents thought that students use drugs at any frequency. This is the sum of the pink bars from 1 to 10% upwards. After starting university, 87% believed that their peers use drugs at any frequency, which is the sum of the blue bars, again from 1 to 10% upwards. Turning then to respondents' perceptions of campus drug culture, over half, 56%, agree that students take drugs to fit in with their peers, while just over half, 51%, agree that they do not have a problem with students taking drugs recreationally. As previously stated, just over a quarter, 26% of our respondents currently do not drink alcohol. We asked respondents who do not currently drink alcohol their reasons for not doing so. A quarter, 25%, said that this was for religious or cultural reasons. 18% said they don't like the effect it has on them or they don't like the taste of alcohol. 50% of our non-drinkers report never feeling like their friends expect them to drink alcohol, and just under half, 48%, feel like not drinking has had a very positive influence on their life at university in general. 4 in 5, 79% of our respondents currently do not use drugs. We asked respondents who are not currently using drugs, but have previously, either as a student or prior to starting university, why they stopped. Nearly half, 49%, reported concern about the long-term effects on their health and or worry about the effects that drugs will have on them. A quarter, 25%, reported high costs. 4 in 5, 82% of our respondents reported that they'd never felt pressure to use drugs when socializing with friends at university. I'm now going to discuss impacts of alcohol and drugs. So we can kind of broadly sort our impacts into 4 main categories for both of these. These are academic impacts, crime and antisocial behaviour, social impacts, and impacts on health and well-being. I think it's worth noting that these percentages on impacts only refer to the sample of respondents who do currently drink alcohol. So 44% of respondents reported missing a university seminar, lecture, or class, while 29% reported arriving late during or after drinking alcohol. 18% reported getting into an argument with people they know, while 15% reported getting into an argument with strangers. In terms of social impacts, 7 in 10, 69% reported making new friends, while just under half, 47%, reported becoming closer to existing friends or family during or after drinking alcohol. Under half, 46%, were reported being unable to remember what happened to them the night before, while 30% experienced unwanted sexual attention from a stranger or someone they know during or after drinking alcohol. This slide refers only to the sample of respondents who currently use drugs or have used drugs in the past whilst as a student only. So in terms of academic impacts, just under a quarter, 23%, report missing a university seminar, lecture, or class during or following taking drugs. 7% report getting into an argument with people they know, while 5% report getting into an argument with strangers. Just under half, 49% report making new friends and or becoming closer to existing friends or family during or following taking drugs. In terms of health and well-being, 21% reported enjoying the experience of having sex on drugs, while 16% said it improved their day-to-day experience of an existing mental health condition. I'm now going to discuss our findings of respondents' awareness of action on responsible drinking and alcohol-free social events at university. So 4 in 10, 41% reported that they're aware of communications related to staying safe while drinking and or communications related to drinking alcohol responsibly. Nearly a quarter, 24% of respondents reported that they're aware of staff and volunteers providing support related to alcohol. 3 in 5, 59% believe that there are enough social events at university that do not involve having to drink or get drunk, while just under a quarter, 24%, believe that there are not enough of these events. Lastly, our findings on respondents' awareness of drug advice and support showed that just over a quarter, 26%, said they don't know anything about the advice and the support available, while only 13% said they know all of the advice and support available. In terms of our respondents' use of advice and of support services, only 5% report using student union run services, while 4% report using university run services for drug advice and support. 35% know that their university has a drugs policy but don't know what it says, while 33% report not knowing if their university has a drugs policy entirely. Respondents' perceptions or perspectives, sorry, on university support varied. However, 4 in 5, 80%, agree that their university should provide support to students who use drugs, while 65% agree that their stance on drugs should enable students to thrive in education. That's all from me. Thank you so much for listening to our findings. Before I hand back to Fiona, I would just really like to encourage you to go and read the report. We have such a range of findings I haven't managed to cover today, but it also includes some of the extra analysis we did of demographic differences in our findings. So look at differences between gender identities and race and ethnicity. We're going to provide a link at the end of the presentation, but I would really encourage you to go and check that out. I'm going to stop sharing my screen now, and I'm going to hand over to my colleague Fiona, who's going to discuss next steps.
Great. Thank you so much, Molly. Hopefully you can all hear me and see my presentation. Yeah, thank you so much for that really interesting overview of all of the data. And I now have the kind of pleasure to go through kind of next steps or actions that if I were kind of a member of staff reading this report, what I would really try and take from it. Little warning, my slides are definitely not as kind of pretty as Molly's, so you'll have to put up with my very kind of plain slides, but hopefully they'll be really useful. So I have picked out 4 key kind of next steps that, like I said, if I were a member of staff taking this kind of data in, what I would look at and what I would think about, and I'm going to go through these in turn. So when we are thinking about, I guess, the first thing that you can do with this data and how it might be really useful, one of the things that I wanted to kind of pick up on is how useful having data like this can be for building a case for resource or further work in this area. And I know Fiona at the beginning kind of mentioned how useful it is, not only in higher education, but also in a range of different services as well. And I wanted to kind of put it into perspective, I suppose, about how kind of impactful this data can be and how much it really shows kind of the impact of student kind of substance use, not just within higher education, but also externally as well as part of kind of the wider population. So if we kind of bring some of these kind of statistics and I suppose put them into a little bit more, a bit more of a kind of wider context. So the current estimation for the number of students that is within higher education is around 2.9 million. That is a slightly outdated figure because unfortunately kind of the government figures are a little bit behind, but it kind of generally sits within just under 3 million students that are within the higher education system. And so if we take some of these statistics that we've taken from the report around student drug and alcohol use, that translates to a massive number of our student population, but not just our student population, the wider population within cities, within regions, within the UK as a whole. So just to kind of give some context to this. So as you heard, 74% of students consume alcohol, and this can roughly be translated into 2.15 million students consuming alcohol, potentially being part of the nighttime economy, potentially some of those students kind of wanting or needing support around their alcohol use. And if we look similarly at drug use, 20% of students have said that they kind of currently use drugs in some frequency, in some capacity. That is over 500,000 people in our communities that we know currently are using drugs, and again, would benefit from support, guidance, harm reduction information around their drug use. Now, looking a little bit at the impacts, because I always think that this is really, really helpful to think about. I've again broken these down and kind of translated them into kind of more wider figures of what we can say. So as you heard, 44% of students who drink alcohol noted that they'd missed a lecture or some seminar as a result of their alcohol use. So that translates to around 924,000 students who are missing part of their education due to their alcohol use. And similarly, when we ask that of students who have missed lectures and seminars due to their substance use, that translates to around 133,000 students. So that is a massive percentage. If we're looking at it from a higher educational point of view and thinking, okay, well, I need to make a case for why this work is important. One of the things we want to do is we want to keep students in education. We want to reduce the number of students that are dropping out or experiencing negative impacts from their drug and alcohol use. That is a really massive number of students who, because of their substance use, are potentially missing out on crucial elements of their education. Similarly, if we think about kind of things like impacts on kind of the local community, I suppose, and the nighttime economy, and also student safety as well. Again, looking at that idea of how many students got into arguments, and this is just with people that they know, because like Molly really helpfully went through, we generally seem to see more students getting into arguments with people that they know as a result of their substance use. But they also do get into arguments with people that they don't know as well. So 18% of students experiencing this due to their alcohol use, 7% due to drug use, translates to around 387,000 students experiencing getting into an argument with someone that they know due to their alcohol use, and over 40,000 students due to their drug use. So again, really massive numbers. And the reason I thought it'd be really helpful to kind of pick these out is because I recognize how challenging it can be in environments where resources are increasingly scarce to build a case. And because sometimes, as we saw, kind of students don't always come forward for that support. It can, in some institutions, in some communities, be seen as a bit of an unseen issue. And so kind of putting into perspective how kind of many individuals student substance use is likely to impact, I think is really, really important to remember. And not just kind of in individual institutions, but across the UK as well. And I thought it was just really helpful to pick out some of those figures so that if you are somebody that is thinking about further work in this area and further resource, it's a really, really helpful kind of pot of statistics to be able to draw on. So in terms of kind of my next step, I suppose. So yeah, after kind of building your case, another thing that the data can be really, really helpful for is thinking about targeting interventions. So again, like I mentioned, kind of I know that there's limited resource, limited staff capacity. It can be really helpful to focus on behaviours that we know are present in student populations. And this data includes a really rich examples of such behaviours. And so if we're thinking particularly about reducing harm in a student population, thinking about the behaviours that we know are most useful to target can be really helpful. And I've picked out a few here, so I'll go through them. So Molly mentioned in the statistics around polydrug use. So this is the use of one or more kind of drugs at once, and we do include alcohol in that as well. So Molly mentioned, I think it was around 42%, I want to say, of students that don't use more than one drug at once or haven't in the past. That's still a massive percentage of students who are using substances that do use more than one substance, including alcohol. We know in terms of harm that mixing substances can be incredibly dangerous. And unfortunately, when there do tend to be kind of serious injuries and fatalities, it tends to be in instances where there has been kind of polydrug use involved. Because we know that that is something that students are potentially doing and may not understand is harmful. If I were looking at kind of targeting interventions, that would be one that I would look at as a member of staff. And you can do that in many different ways. So we've seen a lot of different ways of doing that in kind of higher education, but outside of higher education as well. So there's a lot of really amazing resources like the TripSit resource that is kind of like a calculator where students can put in the substances they're planning on taking, and it lets them know kind of whether there is kind of significant risk of harm from taking those two substances or more than two substances, as we do know from students. I think it's a really worthwhile piece of work to do. And I think that the reason why it is quite common in the student population is because perhaps the harm isn't particularly known. So I would really focus on kind of polydrug use and ensuring that students have the resources to understand the different interactions between different drugs. We also kind of, as well, thinking about students who are using prescription medication. So making sure that this information is also present in things like wellbeing and mental health services, where perhaps students are taking medications to support with their mental health or a disability. Making sure that staff understand the interactions between those particular substances and other substances can also be really helpful resource for reducing harm. We also heard in the in Molly's presentation about where students tend to take substances, both drug use and kind of alcohol as well. And we saw within that kind of one of the most popular places, I suppose, or the most popular place for taking substances for students is within their accommodation, is within their safe space. And I think that this is really important to kind of be aware of, because it's really vital that knowing that we target communications, we target information into those spaces that we know students are using substances. So thinking about things like, if we know kind of, let's pick up on the polydrug use again, well, making sure that those resources we're providing for students are also available in their accommodation services as part of their residences. Similarly with alcohol, so there was a question in the survey, and Molly mentioned it, around drinking at home with friends before kind of people go out, that idea of pre-drinking or preloading, as it might be known. And that is an incredibly kind of rich data point. And I think it's really, I took from that we really need to put resources around alcohol moderation within accommodation. By the time students have entered things like bars or the nighttime economy, they might already be past that moderation point. And so being able to make sure that students are able to access kind of really rich and important information to make that informed choice where we know that they are, I think is really important. I would take that from this data, absolutely. And it's really important, you know, if you are kind of, like I said, building that case for getting more resource, thinking about how you might integrate kind of harm reduction information into those spaces. We've also seen as well, so I'll explain a little bit more about the survey itself at the end when I do it, a little bit of an encouragement to get involved in this year's survey. But we do offer institutional specific data to institutions that receive a certain number of responses to the survey. And we've seen so many amazing examples of interventions being targeted based on this institutional level data as well. So for example, we've seen some institutions kind of target towards student ketamine use, so doing kind of full campaigns around ketamine because they've seen an increase in student ketamine use in this data. Similarly, we've seen kind of other places focus on other drugs such as poppers or cocaine based on what they know that students are taking. And if you don't have access to this institution, will also note kind of the most popular drugs, I suppose, the substances that we know students are taking, it's really worthwhile thinking about how we can target interventions, particularly on those things that we know students are using. And whether that is locally or whether that is nationally. So yeah, I would really recommend kind of going through the report and looking at, okay, well, what do we know students are using, and kind of where are they using it? How are they using it? What's their motivations? And using that to inform kind of these future interventions as well. So I will now go on to my third point around how I would use this data. So how I would use it, I guess, is just I would consider how to use it in terms of thinking about embedding it in so many different levels. I've mentioned before that idea of communications, and it can be really helpful to build data into communications. And I'll talk about kind of social norms and things like that in a moment. But I wouldn't stop at that. This is such rich data, and it can inform so much in terms of staff practice and how we run events and the education that we provide. I would really, really encourage you to think about how you can use this data to build and share a more accurate picture of student substance use. So further than just the communications, which I think is a really nice way of getting information out to students, thinking about training. So we mentioned there around students using substances in their accommodation. Well, actually, do we train kind of residents, life members of staff and students on student substance use? Do we give them the information they need to be able to support a student, knowing that students are likely to use substances in those spaces? Similarly with events. So Molly mentioned a really helpful statistic around non-alcoholic events. And although there was a large proportion of students who said that there were enough non-alcoholic events, there was still a substantial number of students, I think around a quarter of students, that said actually there's not. So again, using that and thinking about, well, are we providing enough spaces that aren't alcohol focused, for both those students that don't drink, but also maybe those students who want to moderate or who are sober curious. And the same goes for education. So again, I talked about how we can use kind of the data to target education. And I think that's really, really important. So we know that students suffer from information overload, and that is just within higher education. But I'm kind of very sure they also kind of experience that from their GP practices, local services, anything else that they engage with around their substance use. And so thinking about what would be most useful for students and what education do they really need to stay safe, I think is really important. One thing that I was thinking about in terms of the where students use substances was, well, actually, if students are using substances in their accommodation, and particularly those students who are using more than one substance at a time, that is really risky behaviour. And so actually, would a student know what to do in a drug or alcohol related emergency? Do they know how to respond in that instance? Do they have kind of access to that information? And things like that, when building education, can be really helpful to think about, and making sure that we're keeping students as safe as we're able to. I also mentioned before that idea of using the statistics to correct these incorrect perceptions and kind of using them as a social norms piece. And I know that kind of outside of higher education, there are a lot of kind of councils and local authorities that have strategies related to social norms. So kind of trying to recorrect some of these social norms, trying to move away from the normalization of drug and alcohol use. And so I think this one could be particularly helpful. So I've kind of given an example of that, I suppose, and you can really see that in the data around the difference between the perceptions before students arrive at university and afterwards. There's something that is adding and contributing to those perceptions. And so we have a responsibility to correct some of those incorrect perceptions as well. So thinking about kind of social norms theory and how that can fit into this piece of work, it's really, really powerful, I think, and we've seen it at institutions, to use data and use statistics to give a more accurate picture of student perception to drug and alcohol use and how they use drugs and alcohol. So I've given that kind of perception there around a common perception that I hear from students is that, well, actually, if I don't drink at university, I'm not going to have a good social life. Or, a similar one might be, well, if I choose not to drink in this particular evening, I might be seen as the friend that's not fun. These are all things that we hear from students. And actually, a statistic that was taken from the data that Molly shared around, well, actually, 83% of students agree that drinking too much can cut short a great night out. So it's really kind of rebalancing that idea that I need to drink a lot of alcohol to have a good night. It's actually saying, well, actually, that might not necessarily be the case. This can particularly be kind of really helpful. When we're thinking about students coming in to the university space. So I'm thinking around those really kind of vital times of year, those welcome periods. And again, not just within higher education. This has a real place within kind of the nighttime economy, within kind of GP services, places that students interact with. I think we all have a responsibility, can do a lot to kind of recorrect some of these incorrect social norms. And the more that we put out that more correct perception, hopefully that will mean that there's less students that feel that pressure to drink, feel that as Molly mentioned, taking drugs or using alcohol is kind of a vital part of kind of the university experience, because we know for a lot of students that it's not. So yeah, thinking about how you can build it in, not just to those communication pieces, even though they are really helpful, but also kind of really weave it through those other aspects of kind of training and events and education that we offer to students as well, both within higher education, but also outside in kind of the local communities. This absolutely has a space there as well. And then my final point that I really wanted to focus on, I suppose, and this is me kind of drawing on my experience of somebody who previously worked within higher education, is to not assume that it is all negative. I think it's very easy to fall into that trap of assuming that if a student is mentioning their substance use, automatically that their experience is going to be negative, or it's going to be negatively impacting their life in some way. And I think the data does a really great job of showing that this isn't the case. I think it gives a really balanced view. It's really important just to recognize both the negative and positive impacts of substance use as experienced by students. And the reason I think this is particularly helpful is because it can really support students to feel heard. If they are entering services and they feel as though there's already a perception of their substance use as this is a really negative thing and you're going to be experiencing negative impacts from this, that can sometimes make students feel slightly disillusioned, or as though their true experience hasn't been heard. And there's some really great examples around kind of students noting how integral kind of alcohol and drug use is to making friends. But also students saying that it improves their day-to-day experience of a mental health condition. There's a lot of examples of how substance use is a positive experience for students. And I think the reason why this is also really important is if we're encouraging students to make changes to their substance use. So, for example, students who come and say, I want support moderating my alcohol use. It's also important, if they're using that as some kind of coping strategy or a way of making friends, to recognize that that's taking away a coping strategy. And so kind of one thing to keep in mind if we are having those conversations is, okay, well, we're taking away a potential positive impact of this substance. How are we going to support the student around that? And what does that look like? So yeah, I think that's a really important thing to remember is I don't want you to come away from this webinar kind of looking at those impacts and think that's really negative. All of our students are kind of really negatively impacted by their substance use, because we know that that isn't the case. So I mentioned before I end that I wanted to do a little bit of a shout out, I suppose, to our survey before I hand back over for questions. We do this survey every year. Like Fiona mentioned, it is an annual survey, and it's so vital to kind of creating so much important information, and it really kind of does drive what we do and the support that we provide to universities and HE in kind of supporting students around their substance use. So in terms of getting involved, it's really simple. All you need to do is, if you let us know that you want to be part of the SOS National Survey, we already have the dates. So it's going to run from Monday 17th November to Monday 8th of December this year. there should be a Google form that is going to be in the chat. We send you some materials to promote the survey, so we will get back in touch with those promotional materials. You promote them to your students. We see lots of different ways of doing this. You can put it on social media, you can have student ambassadors, whatever kind of feels most appropriate. And then if you secure 100 student responses across that 3-week period, you will receive your institutional data from SOS UK. And again, I'm thinking about kind of the members of the community that are outside HE. You are very welcome to share that with local services that you work with. I think it's a really valuable resource. So yeah, please do think about if you would like to get some institutional level data. I think that the national level data is so helpful and can really help build kind of that case for strategy and resource in this area. But I think particularly around the targeting interventions, if you know kind of what your students are using, where, how often, and why, it can really support to kind of make those really targeted interventions. That is all from me. So I'm now going to go on to the Q&A, which Fiona helpfully is going to run. I also want to kind of mention, so we should also get the report in the chat box as well, but if not, it is on the screen to kind of read the full report, and I believe that Rachel shared it before earlier. But thank you so much for listening. I will now mute myself because I have a habit of just keeping talking for a long period of time.
And hopefully Molly will reappear as well. Oh, there you are. There's Molly. That was just so interesting. I mean, you'll see when you have a chance to look at the chat, there's been lots of really positive comments and lots of engagement. There have been a number of questions, which Rachel from SOS UK has been very efficient behind the scenes and answered. But I've got a number of questions as well around that. But I also realised before we launch into those, and we haven't got very long, I know, but I realised I didn't include, I had a big gap in my introduction. I didn't say anything about SOS UK, and I'm sure that most people here, many people here will know what you do, but just can you very succinctly, because you do fun, I mean, you do lots of things, but if we're here specifically in terms of drugs and alcohol, about your programs with universities and how many universities you're currently working with?
Yeah, absolutely. I'm happy to pick this one up. Tracy might have to put in the chat how many universities we're currently working with, because it's always increasing, which is really nice.
That's really good.
So we run a drug and alcohol impact program at SOS UK. So that is a program that aims to support universities and students' unions in partnership. So we ask that the university and students' union works in partnership to create a more kind of holistic approach to student substance use. So it's really embedded in harm reduction. So instead of taking a zero tolerance approach, it's very much embedded, embeds the idea of reducing the harm where we can and supporting students to make informed decisions around their substance use. So we support universities in lots of different ways. I suppose the higher level ways is kind of policy changes, commitment statements, getting that kind of getting that message out there. And then as part of the accreditation, we also ask universities to do a lot of events and activities around student substance use to really embed that culture of well-being being at the heart of everything that we do and enabling students to access support without being fearful of those ramifications. So yeah, that's what we do.
Thank you. No, that's really helpful. Please, we have got time for questions. There have been a few questions coming through that have been responded to, which I'm going to just have a quick look at again, because I think that there might be things to add to it. But also keep adding questions, because we have got about another sort of 5 or so minutes. There was a question around regional differences, but it doesn't sound as though that analysis has been done. But that will be something that could be available, because that could be really useful to know. I know obviously you won't be publishing the results of individual universities because that's their data, but is that something that you are looking to do?
So my understanding is that's an analysis we didn't do this year, but we have got the data and we could do in 2025 when we run the survey again, if that would be something that's of interest to people reading the report.
I think it would be really interesting, and it'd be interesting to see how that relates to other national data, with a recognition that students form a kind of quite a big population component in an area, but come from different areas. So I've just seen Tracy's put in the chat the 16 universities. Did all the universities that you're working with take part in the survey with more? Because I was also interested, you've got a much bigger sample, haven't you, this year than you've had in previous years, which is brilliant.
Yes, so we did. So we do ask as part of the accreditation that universities take part in the survey or do a similar equivalent at their own institution. But we do find that I think most of our partnerships, if not all, do take part. But we also kind of had so many institutions that weren't part of our partnership taking part this past year, which was absolutely amazing. And I think kind of really contributed to this rich data that we've been able to get. And I think that speaks to the fact that a lot more institutions kind of want data in order to build these business cases. And that's what we were hearing was this is really helpful because we can then go to somebody and say, well, you tell us that our students aren't using drugs, but actually it's here and we know that they are. And this is how they view the support that we offer. So yeah, our partnerships, but also a massive range of other institutions that also wanted to get involved as well.
There is a question here because you mentioned support, and there's a question about whether the survey asked if other supporters, because I was really struck, as I'm sure many people have, about the really, really low uptake of support from student union and from university support, and whether support, so local drug and alcohol services, for example, might be being accessed, so stuff off campus maybe. And I know some universities have local services on campus providing support to students. And Rachel has explained very clearly that wasn't something that was asked this year, it has been asked in previous years. But I wondered whether there was, because I know there's so much that in the survey that you haven't been able to obviously squeeze into the time that we've got, but were there any questions about barriers to accessing support? I'm sure many people can have a fair guess at what some of those might be, but barriers, but also enablers.
So,
sorry.
Oh, sorry. Do you want to go, Fiona? Maybe you might be able to add to this, but there was a question about almost kind of focusing on behaviors when seeking support. So we asked the two things that are springing to my mind immediately is, do students prefer to remain anonymous when they seek support? Are they not seeking support because of fear of punishment? So we did ask some kind of broad behavioral questions around what they want from the support provided. But I think the actual barriers is definitely something that we could consider including in 2025. I'm not sure if you have anything to feed into that, Fiona.
Yeah, I was going to say the same. I remember reading about kind of the support that students say that they want the most is that student-specific anonymous support. So I think, again, thinking about that, using this to kind of target information that is specific to students, particularly if you're outside of a university setting, I think, students are saying they want to feel like they are kind of specifically considered and thinking outside of that HE setting, using kind of some of this to let students know that they are considered can be really helpful.
And it might look into the questions around drug policy as well, and an understanding of what drug policy, which might be a misunderstanding. There might be a misconception that they will get in trouble. There'll be penalties if they reach out for help. I had another question. So I've got lots of questions and nobody is asking questions, so I'm going to just ask all of my questions. But I had another question around messaging. Fiona, you made a really good point around being able to use the data to, in terms of messaging in education for students. Jenny Fox, I spotted, asked a question that I also had, which Rachel answered. Jenny Fox, PSHE Association, so also primarily working with 18 and under, but around questions about what drug education, what do they come to university already feeling they know enough about? And I know that isn't something that's in this, you could add so many questions to this survey, I know, but I wondered if there were any good practice examples from the universities you're working with about both messaging. So are there some good examples of messaging that had really positive response from students that could maybe be connected with a reduction in drug-related risk and drug and alcohol-related risk and harm, and also kind of maybe any in-university education programs that have worked well? Oh gosh, sorry, we haven't got much time. I've just seen, and another question's come through.
Right, so I'll try and answer this really quickly. So we have seen some great messaging. I'm thinking particularly to a messaging that happened believe at Durham, around trying to reduce alcohol-related harm on nights out. So they did this whole messaging campaign, very much using the data and social norms theory to kind of say, well, X number of students wouldn't leave that friend on a night out alone, and things like that. And that was really successful in terms of more students saying that they also wouldn't do those behaviors, and a reduction in the number of students experiencing those negative impacts in their personal safety. So that is one that I would say was really helpful. And then in terms of activities, we also run a drug and alcohol awareness week every year. And we also see a number of amazing activities. So I'm thinking particularly related to polydrug use. Keele do an activity which is around basically mixing drugs, and they get a DJ, and it's kind of like I think they did it in collaboration with their like Dance Music Society or something. They got a DJ, and they had resources there where students could almost mix and kind of figure out which drug combinations were most dangerous. So again, we see a lot of really innovative ways in which institutions present this information and reduce the harm in really innovative ways. So yeah, I would really recommend it. And on our website, on the Drug and Alcohol Impact website, we have a lot of examples of good practice and case studies. So if it is of interest, absolutely, please do take a look.
That was going to be my next question, really, was about sharing that. So that's great to know. I see Jenny Robertson's put a comment there about 1625 services, and they are just local to Sheffield and Derbyshire, but that's Change, Grow, Live, and they're really, really good outreach services that have been evaluated as well. And there are just, have we got time to screen a couple of really quick questions? Clarity on what's considered those have been answered in the chat. Drug and alcohol drop-in facilitated. That's how could we provide anonymous one-to-one support? Could this be via an anonymous web chat service or any other ideas? That might be something to take away. It might be that something that other people that are here on the webinar might be offering as well. But certainly that anonymity and online may be something that's preferable to being in a room with somebody. But I think that's yeah, sorry.
No, I was just going to hop in really quickly and say the way that we see that happening in a kind of keeping that anonymity, I suppose, is that students want it outside of their university space. So institutions that use their local services to do like anonymous drop-ins, so it never goes back to the university will never know that you've engaged with it, but sometimes they house those kind of in their students' union buildings or near the university, so it's kind of removed from the university experience, I suppose, is also a really good practice that we see.
Thank you so much. We are going to have to close and let everybody go and get some lunch. But I just want to say on behalf of the world, thank you so much for doing this work, because it's just so incredibly valuable. And hopefully with momentum building, there'll be a bigger sample size. It'll be used more widely and more effectively by the universities that are engaging with it. Before I go, and do the survey, do sign up, look at the website SOS UK. Do also, if it's relevant to you, come along to our summer event for the Drug Education Forum. So there's a QR code there that will book you. We've got fantastic speakers, including Professor Owen Bowden-Jones, who is the man, and talking about the ACMD prevention review, which will hopefully be out by then, which will be, I should say, but really, really, really interesting. We've got some great spotlights as well, which have just a little 10-minute slot. So do come along, do sign up. And thank you so much on behalf of SOS UK for coming, and thank you so much to SOS UK for all the brilliant work that you do and for letting me come and beginning and end of your webinar stay.
Thank you so much. Bye, everybody.
Bye-bye.